All right, good afternoon, everybody. I hope you had a good weekend. Here with Paul and Josh and a couple of special guests I'll introduce in a minute. First off, let me just give you a brief summary of where we are today and over the last few days. I think basically the trend lines continue in a very positive direction, by which I mean the percentage who tested positive is now less than 10%. It's been less than 10% for a couple of days. And we'll see if that continues, but that's a good positive trend. I think there are about 31 states in the country where it's less than 10% right now. 2 weeks ago, almost everybody was north of 10% positive testing. So I think this gives you a trend of what's going on around the country. And for us, that's particularly important since we're adjacent to New York, which still has a higher positive rating. And secondly, you'll see that the number currently hospitalized continues to go down, about 30 this time around. That gives you an idea of trend line. I think we're over at about 18, 19 days in a row with a 3-day moving average. So that gives you an idea that May 20th is still on our horizon. The day-to-day change in hospitalizations, you can see it sort of goes back to more or less April 15th with a couple of little blips in there along the way. So it's worth keeping an eye on that. It's also, I'll tell you that folks being admitted to the hospital is really a top-line trend, not the net number. And there, let's say we were about 273 admitted a week ago. Yesterday was 152. So that's the top-line number in terms of folks infected, serious, admitted to the hospital, going down. We've had about 5,400 total discharges to date. And finally, the positive test day-to-day is, sort of interesting. You see it trending down. You see it trending down, finally, under 10% a little bit, what that means. And that's in part what we see in Connecticut, but also the greater New York metro area. New York City went from an average of 12,000 positives a day to about 2,800 the last few days. So I think in terms of the metrics that we had in mind thinking about our May 20th beginning to reopen date, we're on track. But as I've said before, it's more than the metrics, it's also behavior. On the metrics, by the way, tomorrow we're going to really focus on the PPE, the inventory, how we're getting that distributed, and the testing protocol. You know, we've got some guideposts there before May 20th where we want to be, so we're going to be able to talk about that in some detail. Let me just talk about behavior a little bit, because that's something that we do control in a positive and a negative way. And I've been so proud of Connecticut over these last 2 months in terms of social distancing, the efforts we've made. And I think that by and large, we're staying true to what we've got to do in order to continue to keep that curve going down. But, you know, you look around the world, you look around the country, and there are some warning signs out there. You see that the R0, which is the infection rate in Germany, let's say Germany is a month ahead of us on this pandemic schedule, and they have great track and trace, really good testing. Opened up the schools, R0 went up to 1.3 again. They were below 1, which meant the number of people infected was going down. You know, something to keep an eye on. South Korea, they brought their new infections down virtually to 0. And then you probably saw they had the nightclubs open, people started going back, and it wasn't Typhoid Mary, but it was Typhoid Tommy. And all of a sudden, went to 3 different nightclubs, and I think there were 60, 70 plus infections, and gives you an idea of how infectious COVID is and how fast it can move. We're hearing about the flare-ups in different parts of the country. Again, the trend lines are important, but in Marion, Ohio, correctional facility on fire. Dallas, Texas, a nursing home, and what that meant there. Minnesota, one of the meatpacking facilities. So these flare-ups are something we watch very carefully, and that's why track and trace. Track and trace is like our fire department, right? We go after these flare-ups. We at least are able to contain them going forward. So we know that as we slowly and methodically reopen, we keep it under control. Another flare-up, which maybe took some folks by surprise, is at the White House. As you probably heard, at least two key advisors or somebody took care of the president tested. So, today we had our weekly briefing with the Vice President Pence's task force, and this time there wasn't 10 people sitting around a table in our teleconference from the White House. Instead, it was the Vice President. He walked in with a mask, sat down, took off the mask in there, taking questions, giving a good update. Deborah Burke's in another room separately. It just gives you an idea. Everybody else by Zoom. So everybody is taking the social distancing more seriously now, which I think is a very important trend. They gave us some good news as well, that the remdesivir, which is a therapeutic that can greatly reduce the harm caused by COVID, reduce your amount of time in the intensive care unit. We got our shipment to Connecticut, as well as other states did, went right to our hospitals. PPE, they are ramping up. As I've said before, the supply and demand are getting closer to equilibrium. And the shipment is going out next week directly to all of our nursing homes, just to give them now a little bit of inventory, a little bit more breathing room. They're also proud to talk about the new FDA approval for an antigen test, which is a little like the Abbott test. As you know, the Abbott test is the nose swab, and you can get a positive or negative reading in less than 15 minutes. Well, this is a lot easier to get the sample. This new antigen test that they're rolling out will have about 5 million samples a month, starting within a week or so. It also is a lot less expensive, which is important, something we're focused on as well, with a much lower false positive rate. So this all gives you an idea that there are some changes taking place which are positive. On Thursday, again, we're going to have the Reopen Committee come and tell you about where we are in our protocols, where we are in terms of why we think the decisions we're making are there to keep you safe. Because this doesn't work unless, A, you are safe when it comes to a very methodical reopening. And just importantly, when you are safe, you have to make sure that you feel safe. And, that's what I wanted to talk about a little bit more to you today. We've got two people who are members of our Reopen Committee. Jan Hockadell, who many of you know, represents teachers, represents nurses, and Dave Roche, who represents the building trades and the folks who are out, rebuilding our state. And they've been on our reopening committee, and they've been on that committee making sure that the folks they represent, making sure employees in general are taken care of, and they're front and center in our attention in terms of what we got to do to make sure that we take care of people safely. I want to make sure the store owners feel safe to open their store. I want to make sure that customers feel safe going back into the store, and I want to make sure everybody working at the store or the construction facility feels safe as well. I never really liked the name Reopening Committee because it's really not like we shut down the economy. As you know, 2/3 plus of the economy never closed down formally, but a lot of people just didn't feel safe going, opening up that store or going into that store. As Jan knows, almost all of our schools closed down before we even gave an EO on that at all. And so we didn't close down the economy, and nor does government reopen the economy. We allow more stores to open. We encourage people to feel safe, and we give you the metrics to do it. But it's not until people feel safe that the economy will slowly come back into stride. And that's why I take the public health aspect of this so seriously, and that's why I take the safety of our employees, those going into the school, the hospital, the store, the building site, so seriously. So with that, I'd just like to ask Jan Hockadell to just talk for a few minutes about what she sees representing the teachers and the nurses. Then Dave Roche will talk about the folks doing the building and take your questions. Jan?
Thank you, Governor. Thank you for all you're doing and for including us on your committee. I do also think it's really important that folks that are working on the front lines have a voice. And so for me, that means the educators, the healthcare workers, and the state employees. But I'm on the education subcommittee, so I'll focus there. Obviously, as you said, everyone has heard numerous times safety is our main concern. We've surveyed our educators several times. And when schools are reopened, teachers are not only concerned about their safety, but the safety of their students and everyone who works in the buildings. And they're also concerned about their families at home. We know that students and adults can be infected with the virus and not actually have symptoms, and then they would spread the virus to others. And that could include elderly relatives, members of the family that may be immune compromised. So there's definitely been a lot of discussion so far on how do we do this safely. And as we were mentioning this morning, educators would love to go back to the classroom. Our survey showed that teachers do not believe distance learning is an effective long-term method. Our students are facing too many obstacles, like parents that are not able to assist their child, the lack of supervision, those that are unable to keep up for various reasons, and one of them obviously being not enough skills or knowledge to utilize the online technology. So teachers are definitely telling me they would love to go back into the classroom, but the safety for themselves, their students, and their families have to come first. And of course, another topic we're discussing is the protections and protocols that must be in place, such as will there be testing? Will there be masks and PPE provided to students and staff? And how will that social distancing be handled? What will transportation look like? Because we're going to have to limit the number of students on a bus, and they have to wear masks, and they're going to have specific seats. What is that all going to look like? And what will be the protocol if someone is showing the symptoms or is confirmed to have the virus? So these are the conversations that are happening, and we're making sure that our educators, administrators, superintendents, everyone in the school community has the ability to voice their concerns and their ideas. And right now we're looking at what camps and summer schools may look like. And of course, that framework will then be the basis for conversations looking forward into the fall. And in the fall, we're going to have to be flexible. We can put a great plan in place, but we have to take into account, what are we going to do if a student or a teacher contracts the virus? And what are we going to do if the state has another surge? So a lot of things are being taken into consideration. And I think most workers in the state are very concerned about how they're going to do their jobs. I know the educators are worried about the resources for their jobs. And as you know, there's been a lot of talk about state and municipal budgets. Will they have the resources to be successful? In education, will art, music, and shop, courses that keep many of our most at-risk students engaged, be available? Will our paraeducators be protected so that they can support our most vulnerable students? But those are the same concerns that are being felt in hospitals and in state buildings also. What will jobs look like when we reopen the state? So again, I mentioned this morning that most educators expect that school will look and feel different with a hybrid of in-person and distance learning. And they're concerned about how they will provide remediation and catch up for students in every grade level, especially for special education students, English language learners. But that could also be said for our hospitals and office buildings. How we work from now on is going to be different. But with the input from those on the front lines, we can weather this together and come out better. So thank you.
Well, thanks, Jan. And Jan's referring this morning to a live video conference that went out on CTN, which is maybe what you're on now. So you can watch that if you have any questions about what the educators had in mind. Dave?
Good afternoon, Governor. Thanks for having me on today. It's really a privilege to be able to sit on this committee and represent the workers of Connecticut, especially on construction sites, but all workers. In the beginning, we were a little apprehensive when we found out job sites were going to stay open. As you know, Boston, New York closed a lot of theirs down. So we had some concerns. Job sites, as everybody knows, aren't the cleanest places in the world. You have to use portalets. You have to, not a lot of cleaning stations. So we felt there was going to be a lot of challenges to getting this done. But right out early, you signed Executive Order 7. We worked with your Chief of Staff, Paul Mounds. We were able to get some really good stuff into place early. And I think if you look at the overall infection rate on construction jobs, it was low. I know from the numbers I've taken from our members, we didn't get a lot of infections throughout the projects. When we did, we shut projects down and got them disinfected early. So things worked out really well. As being part of the committee, what we're doing now is taking best practices. We use some from them areas like Boston, New York, what they're going to put in place. What we saw work for us, take them best practices, working with the committee to make sure that, things are going to change for us to keep everybody safe. We're going to have to get used to maybe staggered shift starting times, shift work more on the projects, wash stations more throughout the projects, a lot of different things, that are going to be put in place moving forward. And I think we're going to learn from, the jobs that we're going and just keep everything moving in the right direction. I can tell you, our members have been doing a great job of making sure they follow the guidelines, but we got to make sure that we have them in place going forward to make sure everybody keeps doing that. We don't want anybody to get lazy and start saying, okay, everything's good now. We don't need to have many more infections, and we want to get building Connecticut again like we should be.
Let's rebuild Connecticut. Thanks, David. Max, questions?
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. Last week, Josh had talked about a big PPE delivery that was supposed to happen this weekend. Did that, in fact, happen?
The answer is it did. A lot came in, and we're going to break that out for you tomorrow in some detail and have an announcement then.
And then just following up in terms of the businesses that will be expanding operations or reopening next week, will the state be helping those business owners acquire PPE so they can open safely?
Well, they are responsible for getting their own PPE, but that said, we do have a backup plan. We've got via CBIA for those small businesses, we can get them the masks and other support they need if they can't get it themselves.
Channel 3 Eyewitness News.
Yes, this is a question for the panel, kind of following up on protecting the at-risk workers. We're hearing from a lot of people, in their 60s and older who are frankly kind of nervous about getting back to work. They don't want to go back, but they're kind of going back to work out of necessity. So what is your message to those workers? How are you going to protect them?
Want to start off with that, Jan?
Sure. I know that is a very major concern for many of our educators that might not be that old, but may have conditions that they just don't feel comfortable going back to work. And as I mentioned before, or may have someone at home that they're afraid that they may bring something back. So that's why I think it's so important that we get these plans right on how we're going to reopen, how we're going to protect our workers, and the people that they serve. And again, that doesn't just go for education, that goes across the board. I think we have to make sure everybody's has the proper protection so that they can keep safe.
Governor, anything else that you would like to add to that?
I would add that people over the age of 60, 65, I don't really want them going to work in the near term. People with pre-existing conditions should not be going to work. So we're going to have to figure out what is the right way to handle that given some of these learning situations. If they're a teacher and they can do a lecture because they're at a community college, there are other ways that they may be able to participate. But I think going to a public place where you're naturally liable to congregate is probably not a good idea, at least for the near term.
So do we think that they might be able to still kind of claim some of the unemployment benefits or something like that?
Yeah, we're looking into just that.
Thank you.
News 12 Connecticut.
Hi, Governor. Some of the mayors and first selectmen are asking you to reconsider the restaurant reopening rules. They're saying that they're hearing some restaurants just can't feasibly do outdoor dining. Has there been any thought about maybe letting restaurants operate at reduced capacity, if they're large enough, or, forcing municipalities at least to change their land use rules or zoning rules, so that more places can offer outdoor dining?
Yeah, I like the latter part of that more than the former part, which is, look, I've been impressed. I see, I was talking to Freddie Camillo. He's the first selectman of Greenwich, talking about shutting down the main avenue there and allowing all the restaurants to be outside on a warm day over the course of the next month or so until we find what we're doing inside. I was reading about Sarah Bronin running zoning here in Hartford, thinking about the same way that more outdoor access for these tables and restaurants, I think, could help bring the towns to life, the cities to life, and also make it much more viable for our restaurants. I am a little hesitant, though, about just going right into indoor dining alongside outdoor dining. I think that's going to take a little bit longer.
And Governor, real quick, the CCDL, the Connecticut Citizens Defense League, has filed a lawsuit about your Executive Order 7E that allows police departments to suspend fingerprinting. They're alleging, this is making it virtually impossible to buy a firearm and get a background check. What would you say to them?
I'd say the overwhelming majority already have that fingerprint, and I'm sorry about the few that don't, but right now we're in the middle of a pandemic. We're going to have to be a little careful for the near term.
Fox 61.
Hi, Governor. Zinnia Maldonado at Fox 61. So just last week, we asked when non-emergency procedures would begin at dentist offices. And David Lehman said it could be ASAP. It's up to dentist office when they feel equipped and ready with PPE. But since this, we're hearing from so many hygienists emailing us that dentists are choosing to open back up their offices, but they're not exposed to the same dangers as hygienists. And hygienists say it's unfair that they're being asked to go back to work so soon, especially when cleanings and such are non-essential. So we want to know, what job protection do hygienists that can't work from home have when so many feel like they have to choose between their job, being employed, or being safe from COVID and not going to work?
I think I'll probably hand this one over to Josh, but as you know, we're working very closely with the Dental Association, talking to hygienists. We never closed down dentistry, at least kept it open for emergency purposes, and this is a complicated one, which is why I'll hand it over to Josh.
So we've heard a number of those concerns, and as a result, we're putting together a small group that will include representatives both of the Connecticut Dental Association as well as some hygienists to sit down and talk about the concerns, see if there's consensus and how we would move forward, and if additional rules or restrictions are appropriate at this time.
And so, as a follow-up, in the meantime, would, many hygienists want to go back to work, but just not right now. Would you, Governor, reconsider pushing that time frame that dentist offices are allowed to reopen for non-emergency procedures to a later phase?
I think I'm inclined to let it play out a little bit. Let me tell you why. I think you're going to find, like most of these store openings we're talking about, the consumer, in this case, folks going in for a dental checkup, are going to be slow to go in. I think it's not going to be at full capacity. I think a lot of the hygienists who don't want to go in won't have to go in because there won't be demand at this point. But if I find I'm wrong on that, then we're going to have to take a second look at it.
WTIC 1080 News.
Hi, any developments on rules of enforcement for the many rules you released last week for restaurants, offices, and so on? Are we going to hear this week about what penalties might be in place?
Right now, my understanding is two things. One, we have a hotline that will be established so that if people find violations of these rules, we have, I think, some of the clearest rules right now of any state in the country. We've been talking a lot, and we're sending out our protocols to others. And we're learning all the time, as I just mentioned in the case of the dental, how we can make that even more appropriate and better. And right now, you can self-report, and we'll get the information. We'll go out and have an enforcement mechanism there, somebody either from the local municipality or ourselves, state police or otherwise, saying these rules are the executive order and they should be enforced. Maybe we warn you the first time.
Can you trust people to do that? I think I asked last week about honor system. I mean, it has to be a little tougher than that, right?
The second time around will be tougher than that.
The Associated Press.
Governor Beth Bye this morning announced that summer camps will be allowed to open starting late next month. Can you talk about whether that includes overnight camps and what kind of restrictions will be in place for those? And then if you could address this idea of a subsidy for summer camps for essential workers and who that includes, and is it 3 weeks?
Paul, do you want to take that?
Yeah, on your on your first part of the question, there's going to be relevant guidelines that's going to be coming out from the Office of Early Childhood, working with the Reopen Connecticut Committee on those related camps that do reopen, similar to the guidelines that we put forth for restaurants and retail and so forth. On your last question, I know currently we have the program as it deals with overall child care services for essential workers, and I want to say that Commissioner Bai and her team will be working on the relevant programming for summer camps as well. That will be forthcoming.
And does that include overnight camps?
No. No.
Not yet, I guess. Is that what you're saying?
Yes. No, it does not include overnight camps.
The Day of New London. Hearst, Connecticut Media.
Hey, Max. Hi, Governor. How you doing?
Doing good, Ken.
What kind of backlash have you gotten on the no hair dryer edict as part of the salon reopening? Your ears burning?
Annie mentioned it to me, actually. You know, we talked to a lot of salon owners, and you know, there was some trepidation about opening up a hair salon, even on a very selective basis with very strict protocols. And I was told that the idea of a hair dryer is more likely to be able to spread the germs, and employees and customers agreed that it's probably the safest protocol to not allow it for now.
What kind of planning or what kind of discussions have you had about the inflammatory syndrome that these C19 kids are developing? Is there any increased monitoring of kids with COVID?
Yeah, I talked to Dr. Koh about that this morning. He did mention to me that we have 3 cases at Yale New Haven Hospital right now. We're monitoring closely. It seems to impact young people, you know, anywhere from 3 months to 13 or 15 years. It results in a severe inflammation of some of the glands. And so it's something we're really concerned about. I think right now it's a very, very tiny risk of infection. It was not really ever detected in Asia, which I don't quite know what that implies. But I'll tell you one thing, Ken, to me, as I thought about it, is, you know, a lot of people say, hey, let's open the door, let young people get a little infected, we'll get up to the herd immunity, and we'll get through this. And we realize every week that we don't know everything about this virus. We maybe have, 6 months of experience with it. And we don't know what some of the medium-term and longer-term effects can be. And that's why we've got to be so careful. We thought young people were almost immune, or at least they weren't that likely to have complications. We're learning otherwise now in some rare cases.
Did that come up on the call with the White House today by any chance?
No, it did not.
Like trying to classify it and report it for surveillance or anything? No.
Nope.
Thank you.
Connecticut Public Media.
Allie Wachowski for WNPR. You're saying the state has a surplus of tests and that we need to test more people. So as the state readies to go back to work, what's your message to someone who is asymptomatic but wants a test right now? Should they go and get it, or should they wait?
I'll start on that. Right now, we have a little bit of extra capacity. For example, the drive-through tests, in New Haven, the Abbott Lab, in 15 minutes you get a result. So I think we're trying to expand the base of people who get tested, including the asymptomatic. Our first priority as we ramp up is to test everybody in the nursing homes, all the first responders out there. I told you Electric Boat and some of the other factories are testing people in and out of manufacturing. So those are going to, which are asymptomatic, by the way, those are going to be some of the priorities we have before we broaden it to all asymptomatic. I think long-term we'd like to have a better feel for what the community contagion is, and that includes testing the asymptomatic.
And testing capacity, you said you wanted to get 42,000 tests a week when we reopen the state. Can you give us a hard number? What is our current daily capacity for testing?
Want to take that?
Yeah, it's increasing each day. I think we'll have some announcements on this regard over the course of the week, but we are well on track to achieve that goal. I think from a testing capacity perspective, we're certainly well on track, as the governor pointed out. The other part of this that's important is to get people out to get tested, both if you have any symptoms whatsoever that could be COVID related. We strongly encourage you to, at this point, go out and get tested. And then, as the governor mentioned, we're significantly increasing our outreach to key at-risk groups, whether that's in our prisons, our nursing homes, other congregate settings where we've learned from this disease can be quite susceptible to outbreaks. So we're really ramping up the testing there as well.
CT News Junkie.
Thanks, Max. Hi, Governor.
Hey, Christine.
I'm just wondering, how does a person get added to the reopening committee?
Well, right now, we're reaching out and having every interested group is talking to the reopening committee as regards their particular industry or the faith leaders, nurses. So we're reaching out from that point of view. I'm not sure, we've already got 48 plus people in and around the reopening committee. It's a little unwieldy, and frankly, I'm not sure what it's going to look like after May 20th. So I'm not sure we're adding on any new people right now.
Okay, because it seemed that for the education committee today, that there were at least 2 or 3 members who were not necessarily part of that committee, but were presented as if they were part of that committee. So are participating as members of that committee. And so that kind of goes to transparency there. And also with the education committee for reopening, would it be acceptable to add a parent or a student representative?
I can tell you that parents and students and PTA have been actively involved in discussions about what we're doing going forward. You know, Jan maybe could speak to this as well, but like I said, I'm not sure what the life is of this committee right now, so we may be reaching the end. Yeah. Jan, anything you want to add?
I would just say that we've been working extensively and we needed other people's inputs, like the administrators, like the superintendents, more about how the building is going to run and what that is going to look like for the teachers and for the students. So they were invited into the conversation, but we're always looking for people's input. I think it's really important that we get every stakeholder's information and concerns.
Okay, so I'm just trying to figure out, you know, as far as the transparency is concerned, you know, there was an original press release that had a list of the committee members, and it seems to have changed from that original list. So it's just, you know, good for transparency to see who has influence here. And then my other question was, the Baltimore Sun had a story today about the U.S. Customs and Border Patrol seizing illegal shipments, and it said that shipments of PPE and coronavirus test, and the story said that some of the equipment was headed to Connecticut. Can you confirm that?
We have not had any reports of any of our orders either being diverted or you know, any other issues related to them. Obviously, there's lots of entities that order directly in the state of Connecticut. Most others do their own ordering. We're, as the state, really meant to be the backstop in that regard, but we haven't had any issues. I have seen many issues written about around the country now that where there have been issues, but we haven't had any, at least at this point in Connecticut.
Okay. Thank you.
Hartford Current.
Governor, we've been told that there's a plan to test everybody in nursing homes by the end of the month, which seems like a very ambitious plan. Can you just confirm that that's the case and give us a sense of what the plan is in terms of testing in nursing homes?
Want that one?
Yeah, no, we are working our way through the nursing homes. We, since in the last week since we started testing much more broadly in nursing homes, we've now deployed 2,400 test kits to 20 nursing homes, including straight through this weekend. So that activity is ramping up significantly. Exactly how long it takes us to get through all the nursing homes, we're looking at that based on the testing volumes and the availability of swabs and so forth, but we're moving quickly now.
Thanks. I also wanted to follow up on the question earlier about who should be getting tested, because I know that you don't need a doctor's referral anymore, but is it still recommended that you get one? And if you're just a person at home who has a light cough, is your official recommendation right now that you run to the nearest hospital and get tested?
I'd say two things. First of all, one other thing on the nursing homes you might find interesting, at the Penn's task force, they did give Connecticut a shout out, is one of the leading states in terms of having a physical inspection of each and every one of the nursing homes. There is a hotline there. If anybody has any other issues they think we ought to be addressing at a particular nursing home, we can do that. Look, you've got a cough, you've got something that makes you think twice about it, I would go get tested. Yes, I would. You know, right now we have some capacity, so now is an ideal time for you to think about it. If I keep saying this, though, we may run out of capacity, but yes.
All right, thank you.
News 8.
You just mentioned the inflammatory disease, 3 cases at Yale. That lit our phone lines up. People are really concerned about it. What do we know about these cases that people are pretty concerned about it?
I think you pretty much exhausted my knowledge of these cases, but what I can tell you is this is why we have Albert Coe and the leading scientists, and there's very little research on this, and Dr. Coe was saying there's only been one sort of medical report to speak of at this point, but he is researching it every day. He's got 3 cases at Yale New Haven, and I think he'll be able to address it specifically in more detail on Thursday, if that's okay.
Absolutely. You don't know the condition and then of the patients or anything like that. They just have it.
I think they're doing okay.
Okay. And then just for
worth adding too that you know, our Department of Public Health here has been in contact today with the Centers for Disease Control. You know, they're also setting up a surveillance system for any practitioners who think they may have a patient with similar cases. But right now, as the governor said, the details of this particular condition are still very much unclear and being researched by the medical professionals.
Absolutely. You've been talking to New York about it because they have some cases.
I haven't talked to them yet, but I will.
But I mean, has it come up on the calls or anything, or is this just pretty new? This is brand new.
It's brand new for everybody. And as I said, they did try and reach out to Asia, and they couldn't get any information about anything parallel going on there.
Thank you very much.
The Connecticut Mirror.
I'd like to pose this question to the 2 labor leaders who are with you, Governor. Under current rules for unemployment, if somebody who is laid off is called back to work, it must be for suitable work under the state rules. And the suitability, one of the factors that goes into that is degree of risk to the worker's health. So my question is, in the opinion of Jan and Dave, is that sufficient guidance for people to ensure that workers are protected, or do you want to see additional written guidance from the state on this?
Silence is deafening. Any takers?
I'll give it a shot. Yeah, we'd like to see some clearer and guidelines that are out there right now, but we are getting, members that are concerned with getting called back to some of the jobs that did have to close down, and they're questioning whether they're safe or not. And what we're going to, try to do is address them concerns with the workers by going out and actually visually checking out a job site and making sure that, we can look at that before they just turn it down for, I don't feel comfortable going. If you got an underlying condition, then certainly, unemployment should have some guidelines here to protect them from going to work.
Well, since I don't hear Jan volunteering, I'm going to ask a follow-up question. And this to the administration. And Governor, I don't expect you to have this number if it indeed exists, but perhaps Paul or Josh could help. Are you aware of anybody who has been given unemployment benefits during this pandemic strictly because of that language in the rules that it was their workplace was considered unsafe regarding their particular health condition?
Man, that's pretty specific. I don't know if we have an answer for you, but I'd say two things, Paz. I mean, A, we can ask Westby and see if I can get back to you with better information. I think you're going to have more people than jobs out there in a lot of these stores, a lot of these facilities right now. I think it's going to be slow as we get back to work. So dental hygienists or working at that local store or the construction, my instinct is for those people who don't feel comfortable, there'll be some latitude for the near term just because the consumer will be slow to get back into the game as well. So that may be a way that we start to address this for those folks who are, you know, over 60, pre-existing condition, don't feel safe, ways that they can be furloughed in the near term because there won't be the absolute demand for everybody on day one.
Well, since I went 0 for 2, I'm going to try one more.
I got a foul bunt there, didn't I?
Yeah, well, that may be a reflection on my question as opposed to your ability to answer. On the issue of should there be a rebuttable presumption on workers' comp for people who get COVID-19, have you made a decision about whether or not you're going to endorse that?
I can tell you we're still having discussions with all the different players out there. Here's my instinct on it, though, Paz, which is right now we have a workman's compensation system that I hope is working pretty well. And if you're a frontline responder and you're at a hospital and you contracted COVID, I'm just working under the assumption that people are going to say this person deserves workman's compensation because of given the particular circumstance where they are right now. And if they don't get the answer they want, there's an appeals process. And if I don't think the system is working, then I'll step in more aggressively. I'd like to think right now it's working. I've heard that the hospital's done extensive testing of their frontline employees, and there's a very low infection rate, for which I'm very thankful.
Thank you.
Waterbury Republican American.
Thank you. Governor, could you please comment on the deaths? We've reached over 3,000 now. The first death was reported on March 18th, crossed the 1,000 threshold on April 17th.
Yeah, I can tell you that it was, what was it, 2 months ago? The Surgeon General came to Connecticut and said, Governor, this is going to be like a really bad flu season. In a really bad flu season, we lose about 100 people. And as you say, we're at 3,000 or approaching 3,000 fatalities right now. And our example is replicated really 49 other times around the country. And, shame on us for underestimating perhaps what could have happened. I think the governors were front and center. I think they took this very seriously early on. I know we've learned something about this. We've learned particularly how it afflicts older people. We know particularly how it afflicts people in congregate settings like nursing homes, and we're not going to let this happen again.
But Governor, you declared Connecticut ready on February 27th. So what about that? Did the governors get it wrong?
We declared what on February 27th? I missed that.
You're saying that the governor said a quote on February 27th?
Yes, back at one of the original news conferences on the coronavirus outbreak.
Well, I'm not quite sure what you're asking. I can tell you that Connecticut, in terms of schools, in terms of social distancing, in terms of lockdown, in terms of visitors to nursing homes, was one of the first in the country. And I think we should all be proud of that. Could we have done everything sooner? I think so. Okay.
And have you heard anything new on the infant who died on, the death was announced on April 1st?
That's the infant? No?
No, we have not heard anything else from the Chief Medical Examiner's office.
Okay, thank you very much.
Thank you. I think that could be it for all of our questions. I just really want to thank Jan and David. I mean, you attesting to what we're trying to do to keep people safe is really important, because I think as I said before, it's, the scientists can tell you what the safety level is, and nothing is absolute. Nothing is 100%, but we're making judgments there. But as I also said, Dave and Jan. It's also important that people feel safe, that they feel that there are people looking out for them, that they have advocates on the Reopen Connecticut Committee, and thanks to you there, I think people have a little bit more confidence. This is not a light switch. Not everybody's going to pour back to work, but every day I hope they feel a little more confidence thanks to the work you're doing and the scientific community is doing, and what each and every one of you are doing to keep yourselves safe and your families safe by respecting the social distancing, testing where you can. We're going to get through this. Thanks, everybody.
Thank you, Governor.
Thank you, Governor.